What do you think is something important to consider when selecting a benefit plan?
Great question in terms of the best benefit plan. And I know people can't see me, but I'm putting air quotes around the best benefit plan. Some employer groups offer more than one benefit plan, right? So it seems, I think from a consumer standpoint, a member standpoint, it can be really confusing because you're like, oh my gosh, I want the best one. And the best one is the one that I have to pay the most money for.
Welcome, listeners. Today we are pleased to welcome Carey. Carey has worked in the insurance industry since she was a teenager. And if you need some thoughtful direction on your plan, Carey is a great person to know. She's smart, kind, thoughtful, and has a dry sense of humor that we appreciate very much.
Welcome, Carey.
Hello, thank you for having me.
Well, we invited you to join us today because you're one of those people who is so connected in the industry with colleagues across companies, with brokers and clients. And I think you really have a 360-degree view of health plans. So your perspective is really unique. And I think if the Wizard of Oz had a narrator, it would be you, because you think so holistically about the member impact, the client impact, the broker impact, and the impact on servicing. I just feel like you really lend so much to this conversation. So we're so glad to have you here. And usually we provide 3 questions to our guests and ask them to pick one, but we're going to ask you a special question. And that question is, what do you think is something important to consider when selecting a benefit plan?
Great question in terms of the best benefit plan. And I know people can't see me, but I'm putting air quotes around the best benefit plan. Some employer groups offer more than one benefit plan, right? So it seems, I think from a consumer standpoint, a member standpoint, it can be really confusing because you're like, oh my gosh, I want the best one. And the best one is the one that I have to pay the most money for, right? That's not always
or the least, depending on your financial situation.
Right. Or depending on your pocketbook, right?
Yes.
But really, I think we need to take a step back and examine what it is about what each plan that could work for you based on your own consumption of healthcare. And when I say consumption of healthcare, I mean, do you have prescriptions? Do you have regular doctor visits beyond your preventive screenings? So really kind of taking a minute to sit down and examine, how am I using my healthcare dollars? So let's talk about examples, because I think that would be easier for members to understand. So let's just make it as simple as possible and say that my employer offers 2 plans, right? One is a copay plan. So I pay just a copay when I go to the doctor. I pay a copay when I go to the emergency room. I might have a copay when I go, if I have to have an outpatient surgery done. And I also have a copay for prescriptions, right? But the cost, what it costs me as an employee out of my paycheck might be double what the other plan we're going to talk about, right? And then we have what's referred to in the industry as a qualified high deductible plan. So generally speaking, it has a higher deductible. And if it's HSA qualified, and HSA means health savings account, if it's HSA qualified, I can establish a health savings account with a bank or another fiduciary institution to help save money to pay for my deductible, right? And with a health savings account style plan, it has to be a qualified high deductible plan. The minimum deductible amounts are set annually by the IRS, and prescription costs are included in the deductible. And this is the key thing to understand about high deductible plans, is that you're paying the actual cost of all of your medications and the cost of any services rendered at a medical doctor's office or a hospital. You have to pay those up front, similar to a car deductible, right? I have to pay X amount of money for them to fix my car. You're having to pay X amount of money before your health plan will start covering your benefits. Okay.
So when you say deductible, like when you see that plan that is, 3,000 single or 6,000 family, or sometimes maybe 5,000 single and 10,000 family, you have to spend that much money out of your pocket before the benefit where the plan starts to pick up and you move into a different kind of arrangement.
Correct. So if I'm single, right, and Sarah's first example, we'll say it's $3,000. So you have to spend $3,000 of your own money before the health plan benefits kick in. So generally speaking, after you hit that $3,000, most plans will revert to co-pays again. But you have to be cognizant of what is the deductible, right? And can I afford to pay that out of pocket initially? Some employer groups will help you pay for some of those dollars. So some employer groups will contribute to your HSA account, your health savings account, to offset that higher deductible amount, right? And also the amount that's coming out of your paycheck is going to be significantly less than it would be with a copay style plan. So you really want to think about, is me or anybody in my family on a high cost medication, right? Because on the high deductible style plan, you're going to have to pay when you walk into the pharmacy, whenever your plan year resets. Most plan years reset January, so we're going to use that in our example. If the cost of the medication is $1,300 and you walk into the pharmacy on January 5th and you have to get that medication, can you afford to pay $1,300 right there? Or do you have money set aside that you can help pay for that? Something else to consider is that, do you have regular doctor visits? So if you have to see multiple specialists, right? So specialists' office visits are probably going to be in the neighborhood. Again, geographic things vary dramatically, so do not take this as gospel. But let's just pretend a primary care doctor's visit is $100. A specialist office visit might be $175. We're just going to use that as rough numbers. So you walk into an endocrinologist on January 10th. Can you afford to pay the $175, right? Do you have the financial liquidity to do that? Or is it safer for you to be on a copay style plan? What I encourage everyone to do is really stop and think about how you're consuming healthcare. How many medications do you get? How much is that costing you in copays? How many times are you going to an office visit, right? So how many copays do you have for a primary care sick visit, right? How many times do you have to go to a specialist office? Keeping in mind, preventive is covered in full, so we really don't have to worry about, your annual physicals, your annual blood work, your mammograms, your colonoscopies. Those are all covered in full. And then sit down and do the math and figure out, okay, how many copays do I have? How many prescription copays do I have? How many doctor's offices copays do I have? And add that to what you're paying out of your paycheck every pay period. And then you're going to do the same analysis, like, what if I was on a high deductible plan? And, how much is this medication? There are resources available online to find out what the actual cost of medications are. Keep in mind that, generally speaking, your insurance has some kind of deal with the pharmacies, so it would be a reduced cost, but you can get a good sense from your pharmacy receipts, how much that medication actually costs. And so you're going to do the same analysis with the high deductible plan, like how many prescriptions do I get and what is the actual cost, right? And then add your total cost to what comes out of your paycheck at the end, each pay period. And at the end, do the analysis, which makes sense from a financial standpoint, but also what makes sense for you and what are you comfortable with? Are you really comfortable, as I said before in one of my examples, having to walk into a pharmacy January 5th and paying $1,300? Can you do that? And certainly there are people that aren't able to do that. But it's something that you need to really, really think about to determine what's really the best plan for you and the best plan for your family.
I think too, when you hear open enrollment meetings, right? I mean, these are the kind of scenarios that you could really work through, with people that have these kinds of questions when they're renewing each year. You kind of get the memo, and some people are like, whatever, I'm just going to pick the same plan, but your situation could have certainly changed in that past year. And so just, a lot of these examples you described, I think it would be smart if people attended some of the open enrollment sessions just to, have these conversations with the rep that's there.
Right. Yeah, your employer generally, most employers have open enrollment meetings every year. There's reps generally available. I know with what's going on right now with COVID, that some plans are, some health plans are making their representatives available virtually. You can schedule one-on-one meetings, or maybe it's a larger Zoom meeting where you might have the opportunity to say, I have an individual question. Can we touch base offline? Don't be afraid to ask, right? And don't be afraid to ask the people who really understand benefits these questions, but make sure that you're also coming prepared with the scenarios, right? So walking in, I don't know what medications you're taking. I don't know what kind of doctor's visits, you and your family have to go to. So if you're coming in and want to really break down a scenario, we're happy to do that with you. You just need to come prepared to those meetings.
I think it's helpful to think about, to know what you have to think about when you talk about like bring the story. You can help somebody figure it out for themselves if you understand the story, but they may not know what the story is they need to tell. And I feel like you really outlined what are the things to think about, because when you look at them on paper, sometimes that the copay plan looks safer just generally from the high deductible plan with a health savings account. But if you actually go through the process and do the math, and it took me, I think, 3 years of doing the math to figure out that the plan I always picked year over year over year was not necessarily the best plan for me financially, because of a whole mess of things that were going on. And you can switch back. So if one year, even to try it out, because that was our initial decision, is let's see, mathematically, this seems to make sense. I'm absolutely terrified, but let's see how it goes. And, in year one, knowing that I could, at the next open enrollment, change back to the copay plan if that was really something that was more suitable to my risk tolerance.
Right.
But again, doing the math and being really thoughtful about it was probably the first time I actually thought about my plan and how I pick my plan in that way.
Yes. And we probably would have to record a whole other episode, right, to start talking about health savings accounts and what those can do for you long term, and also flexible spending accounts, which is another option for you to take tax-free dollars and really save that just for dedicated healthcare expenses. I don't think we have the time to kind of go into that today, but I think certainly myself or somebody else can cover that for someone in a future topic.
Yeah, that would be amazing. Who doesn't love a health savings account? This is how you know you're like an industry nerd, when you're like, it sounded really exciting.
Yes.
Oh, good stuff. Good stuff. Thank you so much, Carey.
Thank you for having me, ladies.
Thank you for joining us.
This podcast is brought to you by Nova Healthcare Administrators. If you're wondering how they allowed us to do this, it's because at the end of the day, every Nova associate is driven to do what is right. We want what's best for our clients and their members, and we do a great job sharing what we learn with each other. Between our colleagues and business partners, we know a lot of kind, smart, and thoughtful people who we convince to share their tips with you.
And don't forget to leave us a review or give us a like or subscribe, but most importantly, share. We'll find the insiders and you share it with the outsiders. You can find our podcast on Apple Podcasts, Spotify, and pretty much wherever you're finding podcasts.